Hi, and welcome back. Or if you're just joining, I'm Jessica Bowles, licensed social worker with Global Healthy Living Foundation and Arthritis Power. Today, I'm joined by Dr. Beverly Thorne, former professor and chair of the Department of Psychology at the University of Alabama. In this podcast session, Dr. Thorne will be providing us with a brief introduction into cognitive behavioral therapy, or CBT, and the tools patients and their doctors may use to help address the psychological impacts of chronic pain. Beverly, thank you again for taking the time to share all your great work and for speaking with me today.
Sure, thank you.
Would you mind giving us a little kind of an overview about cognitive behavioral therapy, or CBT, and maybe tell us a little bit about your research projects related to this topic as it's connected to chronic pain?
Sure. So I think first and foremost, the most important thing to realize is that getting a referral for cognitive behavioral therapy, or for any kind of psychological therapy for that matter, does not mean you don't have real pain. These techniques work for people with real pain, and we know that we are working with people with real pain. So just because you're going to a psychologist or a social worker or a licensed professional counselor to help you manage your pain does not mean your pain is all in your head, and does not mean that medical treatment is not appropriate or won't be effective. This is part of a comprehensive treatment program. But if we just ignore the psychological and the social, if we just treat every pain as if all it is a tissue damage signal that's going to that brain and ringing that pain bell, we're only treating a small part of the pain problem, and we're not going to be as effective. And what we have found out with cognitive behavioral therapy is that it can actually enhance the effectiveness of other treatments, biomedical treatments. So it can be a part of the treatment team approach and actually enhance the overall effectiveness. So cognitive behavioral therapy capitalizes on the idea that our thoughts and our emotions and our behaviors, our actions, make a great deal of difference in how we actually manage chronic pain. Just as one example, if you have chronic pain and you wake up in the morning and you're stiff and you don't feel like getting out of bed, and you really don't feel like doing much of anything, and you go back to bed because you have pain, is that going to serve you well? In the short term, it might. In the short term, it might be exactly what you need to do to take care of yourself. But imagine if you did that every single day when you woke up in pain. And most folks with arthritis do wake up in pain. I wake up in pain. But if I stayed in bed every day that I woke up in pain, eventually I wouldn't be able to get out of bed. And so we know that that doesn't serve us well. That's an action kind of thing. If our thought processes are saying to ourselves, I'm a loser, I'm damaged goods, I'm no good to anybody anymore, what do we think is going to happen to our pain levels? Well, we know for sure people that are saying those kinds of things to themselves actually have greater levels of pain, and certainly higher levels of depression. So to pay attention to those thoughts, to pay attention to one's emotions, to acknowledge that they're angry, that they have to deal with this, but to channel that anger appropriately, and to pay attention to how all of that folds into your thoughts and feelings, how it folds into your actions. It makes a huge difference in how well you're going to cope with a chronic condition like chronic pain.
Yeah, and I heard you say a really key point about who a person may be connected with if they want to start considering cognitive behavioral therapy or other similar supports. But would it be through their doctor that they would get this process started? You mentioned social worker. And then another kind of part two to that question is, And we get this question a lot from our patients is about cost. Is this something that's not obtainable, or could it potentially be covered by one's insurance plan?
It depends upon your insurance. We'll start with that. It depends upon your insurance. But most insurance companies have mental health coverage. And so mental health practitioners can bill for cognitive behavioral therapy, and the patient can be covered in that way. Also, they're called procedural codes that billers pay attention to. And mental health practitioners, and I'm most familiar with psychologists because I'm a psychologist, but mental health practitioners don't have to give you a mental illness diagnosis to treat your real pain. They can give you diagnostic codes that are psychological therapies for people with real biological illnesses. So we work with cancer patients, for example, to help them manage the stress associated with cancer. They don't have a mental illness diagnosis. We work with people who have had a traumatic amputation. They don't have a mental illness diagnosis. Those procedural codes allow us to bill and allow us to get reimbursed and allow the patient to have coverage for those. But I will say that not all insurance companies pay. And the way we carve it out between mental illness and organic illness or biological illness is a silly distinction, because any organic illness is always psychological. I mean, that's just part of it because it all is happening in our brain. And so the whole thing needs to be treated, not just a small part of it.
Would you say that cognitive behavioral therapy should be necessarily used alongside other therapies like medication, for instance, or can it be used by itself to treat chronic pain, or what are your thoughts on that?
Well, I think that all therapies should be multimodal. If you're just treating your chronic pain with medication and nothing else, you're only treating a sliver of the problem. And so when I say cognitive behavioral therapy, I think it would be silly to say, no, you don't need any medical treatment at all. We don't need to pay any attention to anything else but this cognitive behavioral therapy. I think it is part of a treatment. Now, whether we call it complementary or not, complementary therapies are often referring to therapies that aren't in the mainstream and don't have a lot of research backing. And we know that now CBT is in the mainstream and has a tremendous amount of research backing. And it is helpful to a certain extent. But just like if we treated your pain only with medication, we're only treating a sliver. If we treat your pain only with CBT, we're only treating a sliver. We know through research that interdisciplinary, multimodal treatment programs for chronic pain have the most efficacy. They are the most effective. And that's what insurance companies don't like to pay for. They would rather just pay one individual, unfortunately.
And Dr. Thorne, could you tell us a little bit about some of your resources or how patients can access them?
Yes, and I think you're going to provide the link to the free download for the patient workbook that they certainly can download for free and use. That patient workbook was constructed to help us deliver a 10-week, 90-minute per week group therapy program where we worked with 5 to 7 patients with chronic pain coming together, going through the materials, teaching skills, and interacting with a lot of discussion. Because one of the things we know for sure is experts in pain management are chronic pain patients. They know a lot about dealing with chronic pain. And in a group situation, they're sharing with each other techniques, and they're pushing each other in a way that they can do that somebody without chronic pain doesn't have as much legitimacy to do. So those materials that can be downloaded and used are fine, I think, but they're just a part of the program. But it would give you a sense of what goes on in a treatment program like this. And there are things to think about and write down, and worksheets, very simplified worksheets to go through that might be helpful to a patient. And as I said previously, there's a bunch of self-help books now on managing chronic pain, and they can also be useful. My I have two previous books, not workbooks, but books that are written really for the practitioner, for the mental health practitioner, to help patients with chronic pain. But I have received feedback from patients that they've just gone ahead and gotten the book and worked through the program themselves and found that to be useful.